Did you know that you can change your Medicare Part D prescription drug plan every year during the open enrollment period? Today, I'm going to show you how to use the Medicare.gov Plan Finder to input your prescriptions and price out the most cost-efficient drug plan based on your prescription needs. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to show you how to use the Medicare.gov Plan Finder to look up Medicare Part D drug plans. So we're going to go over how to input your medications, how to sort the plans, and kind of look at all of the details involved in enrolling in a Part D drug plan. Before we get started, if you find the information in this video helpful, I'd appreciate if you give it a thumbs up and subscribe and leave a comment down below. And we can head over to the Medicare.gov website to look at exactly how the Plan Finder works, because it's really important to know how to use this tool. Yes, it's great to work with an agent to find a Part D drug plan, but you also need to know how your drug plan works and what exactly you're going to be paying both on a monthly basis for premium as well as in co-insurance when you pick up those prescriptions. So this is really important for people just coming into Medicare for the first time, as well as people who are changing their drug plans during the open enrollment period every year from October 15th through December 7th. Okay, so let's head on over to Medicare.gov to open up the Plan Finder. Okay, so now we are on the Medicare.gov website. So this is the main page when you get on the Medicare website, and you'll see right at the top there's a button that says Find 2021 Health and Drug Plans. So this is where we're going to go to look at all the Part D prescription plans for 2021. And now I'm going to click Continue without logging in because I don't have a Medicare.gov login. If you do, you can log in here. So once we get here, we're going to answer a couple of preliminary questions before we put our prescriptions in. And the first question is going to ask, what are we looking for? So here we're going to put looking for a Part D plan only. So that's all we want to look at right now are the prescription plans under Part D. And from there, we're going to have to put in our zip code. So I'm going to just add mine in here. And once we hit that, it's going to ask us if we receive any extra help. So we've got any kind of financial help or anything here. So I'm going to click I do not receive help from any of these programs. If you do, you would click it here. If not, you don't receive help, or you can click I'm not sure. And we're going to continue from there. So now it's going to ask us if we want to see the cost of our prescription drugs. And if we do take prescriptions, yes, we do. If you don't take any prescriptions and you're looking at Part D plans, you can click no because you have no prescriptions to add. But if you take prescriptions, it is very important to click yes so we can add them in to price the drug plans out based on what we're currently taking. So I'm going to click yes here. And then when it asks me how I want to fill my prescriptions, whether I want retail or mail order, I'm going to put both because I'm going to see which one comes out more cost efficient, because sometimes mail order is a lot better in terms of co-insurance. Sometimes pharmacy is better. It really just depends on the company and the prescription. So I'm going to click both. And we're going to hit next. This is where we're going to enter our prescription list. So when you're getting ready to do this on the Medicare.gov website, you want to make sure you have the name of all of your prescriptions, your dosage amount, and how often you take them. These are the three main factors when we input our prescriptions. And we don't want to miss a prescription because that could affect exactly which drug plans we pull up. We want to be pretty accurate on the names, the dosage amounts, and how often we take each prescription. So for the first one, I'm going to put in some pretty common prescriptions I hear all the time, pretty low-cost generic prescriptions to give you an idea of how this works. So the first prescription I'm going to put in is losartan. I hear this one pretty often. So when we type it in, I'm going to click losartan potassium, and I'm going to click add drug. And now here's where the dosage amount comes in. So I'm going to put in 100 mgs 30 times a month, so one every day of the month, and we're going to add this to my drug list. I'm going to add another drug because almost everyone I talk to takes some kind of statin, whether it's simvastatin, atorvastatin. Everybody takes a statin, so I'm going to put in simvastatin. So once that comes up, I'm going to hit add drug. Again, we'll get the dosage. Usually what comes up here is the most common dosage, so I'm going to keep it at 20 mgs and say we take it once a day, every day. I'm going to add it to the drug list. I'm going to pick just these two for right now. I'll come back later and add a more expensive drug to show you how things change. and we're going to click Done Adding Drugs. The next thing it's going to ask us for is our preferred pharmacies. So it used to limit us on 3 pharmacies, so you could pick mail order and 2. Now we can go up to 5, which is really nice. We can kind of look at a lot of different options, but I'm going to just pick a couple common pharmacies that you may have in your area. So we're going to look down here. I actually haven't heard of any of these, but I'm going to pick Walmart is pretty popular, pick Walgreens, and I'm going to find a CVS. We'll do CVS pharmacy. So I'm going to pick those 3 pharmacies, and I'm going to click Done. So once we get here, you'll see there are 28 prescription drug plans available in my area. That sounds pretty overwhelming. 28 plans to go through all of the details. But honestly, we don't need to look at all 28 plans because tell you probably about half of them aren't really cost efficient or covering the prescriptions I need. So we're going to kind of stick to the ones that make the most sense for my current prescriptions. And the way we're going to do this is by sorting the plans the way we need them to be sorted. So if you look at sort plans by, we have 3 options. You can sort them by either lowest yearly drug deductible, by lowest drug plus premium cost, or lowest monthly premium. So best way to do it is to sort them by lowest drug cost plus lowest premium cost, because that's going to give you the kind of lowest overall cost. It's going to factor in what you'll pay as a monthly premium, as well as what your co-insurance is going to be to pick up those medications. Drug deductible, not as important, especially if we don't take any really high cost meds. And sorting by lowest premium is a great idea, but if we've got high co-insurances on these low premium plans, we'll end up spending more even though our monthly number is pretty small. So we're going to keep it at lowest drug plus premium cost. Okay, so the first plan we're seeing here is a Silver Scripts Smart RX plan. So as you can see here, it's going to show us on the little blurb the monthly premium, our annual cost, and the drug deductible. So you'll see here the monthly premium for this plan is $7.30. That is very low. That's probably the lowest premium I've seen in a long time. Last year, the lowest premium I saw was about $13. This is almost half of that. It's a pretty low premium. When we look at yearly drug costs, this is going to be the cost for me to pick up the meds, my co-insurances, plus the premium. It looks like overall for the year of 2021 on just these 2 meds, I'll spend about $87.60. That's not bad at all. It really just sounds like it's mostly the premium. And then there is a $445 annual drug deductible. So again, drug deductible comes into play with certain tiered medications, which I'll show in just a minute. But in 2021, the highest a drug deductible can be is $445. So you're going to see that deductible pretty common on most plans. If we scroll down, we'll see it on this WellCare plan, $445, ClearSpring plan, $445. A lot of these plans are going to have this $445 deductible, but it's not as scary as it sounds. So from here, we're going to click Plan Details so we can see a little bit more about this plan. So when we look here, like I said, it's going to show our premium is $7.30 and our deductible is $445. If we scroll down a little bit, it's going to show us the co-insurance amounts based on what tiered medications you take. So typically there are 5 tiers of medications. The higher the tier, the higher your co-insurance is going to be. So for tier 1, which is a preferred generic medication, on this plan you have a $0 copay to pick up that med. So if you take a tier 1 medication, you are not paying a co-insurance to pick up that prescription at the pharmacy or mail order, as long as it's a preferred pharmacy. Generics are going to be a $19 copay, so that's tier 2. It's a little bit of a jump because they're not the preferred generics. So that's tier 2 medications will have a $19 copay. And as you can see, it gets higher from there. So tier 3, which are preferred brand names, will have a $46 copay. And then when we get into tier 4 or tier 5, it changes from being set amounts to being percentages. So as you can see, the majority of drug plans want us to take preferred generics. They're encouraging it by having a lower co-insurance. If you take some non-preferred brand name drugs, which are much more expensive medications, you're going to end up with a much more expensive co-insurance, which is something to keep in mind if generics are an option for you. So when we scroll down and look at the pharmacies we chose, we can see the 4 pharmacies we picked: CVS, Walgreens, Walmart, and mail order. Right off the bat, you can see that Walgreens is an out-of-network pharmacy, so that's going to knock that off for us with this plan. And then from there, we can see CVS is preferred, Walgreens is standard. So preferred and standard, you can pick up your prescriptions at either, but it's going to be lower cost for you to use preferred than it would be to use standard. So let's scroll down a little bit to the specifics of the pharmacies and see how that makes a difference. So as you can see here, CVS is our preferred pharmacy. So for both these prescriptions, to pick them up is $0 because we're at the preferred pharmacy. So the losartan, look at cost before deductible, $0. For the simvastatin, cost before deductible is $0. So you're not going to pay anything toward that $445 deductible. That's why I said it's not as scary as it sounds if you take some low-cost medications. So if we even look further, there's a monthly breakdown where you will see from January to December, if these are the only two drugs we pick up, you will not pay any money in co-insurance. You will have your monthly premium, which totaled up for the year is at $87.60 that we saw earlier as our annual cost. So if we scroll down a little bit more, we will see Walgreens, which is our out-of-network pharmacy. So we're going to skip right over that because we would pay the full cost of drugs on that plan. And we'll go down to Walmart, which is our standard pharmacy. So as you can see, the co-insurance with Walmart is higher because it's this standard pharmacy, not a preferred pharmacy. So now if we decide we have to go to Walmart for these drugs, rather than paying the $0 in co-insurance we would pay at CVS, we're now paying $38 a month to pick up each of these drugs. So $19 for the losartan and $19 for the simvastatin. So if you have the ability to go to a preferred pharmacy, you're obviously going to save money each month rather than going to a standard pharmacy. So you can still pick them up at Walmart cheaper than Walgreens because it still is a network, but CVS is your cheapest overall on this specific plan. And mind you, standard versus preferred pharmacies will vary based on the prescription plan you take. So CVS is not the preferred pharmacy of every plan, and Walmart is not the standard of every plan. It's going to depend on plan specifics. So if we keep scrolling down, you can also look at mail order. So like I said, mail order is usually considered a preferred pharmacy. So same thing with mail order. If you get these drugs, you will get them in 3-month increments. That's why it's not showing January through December every month. And you will still pay $0 co-insurance. So you'll get a 3-month supply every 3 months and you will have no co-insurance. So with this plan, I would definitely go to either CVS or mail order, whatever you're comfortable with. If we scroll down just a bit further, you'll see here your drug information. So you'll see how both of these drugs fall under Tier 1, so that preferred generic, which is why it's got a $0 co-insurance. And we've got our drug list there. So what I'm going to do now is I'm going to scroll back up and I'm going to go back in and add a drug that is not a Tier 1 drug. So we're going to go back to our search results and we're going to edit our drugs and pharmacies. And now what we're going to do is we're going to scroll down and click find and add a drug. And I'm going to put in a thyroid drug that I know is a name brand drug that I hear a lot. I'm going to put in Synthyroid. And you'll see here when I hit add drug, it's going to tell me there's a generic available. So it's going to let me know that levothyroxine is a generic for this drug. But some people don't take generics and they have to take the brand name. So I'm going to click, look, it even wants you to add generic. Big button, please add generic. And then really tiny next to it is add brand instead. So I'm going to click add brand just to show you the cost difference. And I'm going to keep same dosage, that's the most common, the 75 mcg, once a day, every day. So a 30-day supply. Done adding drugs. I'm going to keep my same pharmacies and we're going to go back over to the plans. Still 28 plans. Still SilverScript's coming up as the cheapest with a $7.30. But now look at the difference in our yearly Drug Plus premium cost. Before it was about $87 for the year. Now we're at $558.32 or with mail order $554.67. There's a huge jump for this name brand prescription. So although this is still the lowest overall cost plan, it's significantly higher with this name brand drug. So let's look a little bit deeper and see kind of what had changed. So we're going to click again, plan details. So premium is still the same at $7.30 and the deductible is still the same at $445, but now we've got a new drug that's a higher tier. So let's scroll all the way down to see what tier this drug is coming in at. So Synthyroid, you can see right here, is coming in as Tier 4. So like I said, we already had 2 Tier 1 drugs which have no co-insurance, but now we've got a Tier 4 medication, which is a higher co-insurance. So now we gotta go back up to the top and see what the co-insurance is on a Tier 4 medication. So when we get back to the top, we can see Tier 4 is a non-preferred drug and it's a 48% co-insurance on this plan. Like I said, the number and percentages will vary from plan to plan, but on this plan, a tier 4 drug is a 48% co-insurance. So now let's see, when we go down to our preferred pharmacy, how much that equals a month. So this is where you see that your drug deductible is going to start coming into play, because before you've met the deductible, insurance is not going to pay any portion. So we're going to be responsible for the entire drug cost before we've met the deductible. So as you can see, the Synthyroid retail cost is $41.55. So we're going to pay $41.55 every time we pick up this drug until we've met that $445 deductible, because this drug does have a co-insurance. So if we look down at our monthly costs, you can see from January till October, we're paying $41.55 for this drug. So we have not met that $445 until October. We're paying the full cost of this drug. And as you can see, in November, we've got a little bit of the deductible left, which is why it's at $35.28. And then once we've met that $445 for the year, we're going to drop down to that percentage, that $19.94. And then in January of the next year, it all resets. So we meet the deductible very late in the year with this one drug, but then we drop down, but only for the calendar year. Once we hit 2022, the deductible is going to reset and we're going to start paying that full cost again until we've hit the deductible. So like I said, something to really think about if you have the option to take a generic drug, which I know not everyone does, but it's going to save you a significant amount of money as opposed to brand name drugs. And Synthyroid being $41.55 is not an absurd co-insurance. I've seen them as high as a couple $100s for some of these really expensive brand name drugs. So it's definitely a conversation you would need to have with your physician, not with an insurance agent. It would be with your doctor about what are some lower cost options if there are any. So if this was your list of drugs and we're finding this is the most cost efficient plan, the next step would be to enroll. So if you feel comfortable with the drug coverage and you want to do the enrollment yourself, you are totally able to do that. There's a button up at the right that you click enroll and you're going to join the plan. At this point, you would need things like your Medicare number, your address, and all of your basic information to kind of set up this plan, have everything mailed to you, and set up the billing from there. So something that your insurance agent can work with you on, especially if you're getting a Medicare supplement plan, which is what I do. I assist people in finding the very best Medicare supplements for them. You can always give me a call. My number is 833-65-JAMIE, or use my website. I'd be more than happy to walk you through both Medicare supplement plans and prescription drug plans. I hope you found the information in this video helpful. It's really important to understand how your Part D plan works, not only in terms of your monthly premium, but also in terms of your co-insurance and if things like that deductible come into play, as well as the tiers of your Part D drugs. I've got a video where I explain more about the cost levels on Part D plans, and I will link it down below. If you found this video helpful, I'd really appreciate if you give it a thumbs up and subscribe, and leave a comment down below. If you stay tuned, I'm going to give you a tour of my website and show you exactly how to request a Medicare supplement quote to get in contact with me, and I can go over everything related to Medicare supplements and Part D drug plans. You can also give me a call, 833-65-JAMIE, or you can send me an email, jamie@medicarebyjamie.com. Thanks for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the home page, and the first thing you can see is you can request a Medicare supplement plan quote. And that's what I do. I assist people in finding the best Medicare supplement plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information, like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.